is using the palms of my hands, so kind of fingers up, all right? Deep pressure on the up circle, relax as I come down. And each circle that I make, go just a little bit higher. Okay. Come on back down and start again. All right, I think I need a little bit more lotion, so what do I do with my hands, Amanda? How do I put more lotion on my hands?
You will put it on the top.
Olivia?
So you put one hand up, and then you'll grab or grasp the lotion, and then you'll flip your hand, and then pour it.
Okay, so I'll turn my hand over, but it stays in contact with her. Move it around and put some lotion on. So next one, right, finger pads. So it's kind of like Palmer, but now I'm using my finger pads, the tips of my fingers, to make these little pressure half circles. Come the way up, come around, release the pressure, don't release your fingers from the patient. Again, if you were focused on one side, you could certainly do that. Okay. All right, thumb pads. Again, same idea, but just using thumb pads. My fingers on the sides are just kind of relaxed there, just to keep in contact with her. Up, come back down, and I could, again, do one side. Okay. Notice my hands are basically mirroring each other, working together. All right, picking up is just what it says. We're just trying to pick up the tissues. Okay. Trying to get some separation amongst the different layers. Okay. And then ringing is just picking up and giving a little twist. Okay. Picking up, a little bit of twist. Okay. Is that hurting? Okay.
No.
So be careful when you do it that you pick up enough tissue. If you just get a little bit between your fingers, you might end up actually pinching the patient, and that won't feel good. Okay. And you guys definitely have to switch off partners, because how much tissue lifts and moves, I guarantee is going to be different amongst all of you. So start to feel it. And remember that as you're doing this, besides trying to get movement and impart movement in the tissues and improve circulation, you're also assessing and feeling for anything. All right, and skin rolling. So now it's kind of pick up, but we roll it across. Pick up, roll the tissue. Pick up, you saw it better up there. I could get a little bit better up. And you can go in either direction. Okay. So now as I was doing techniques, down in her lumbar area, found what felt like a little bit of a spasm there, okay? And sometimes patients will tell you they feel a little spasm or something. Sometimes you'll feel it and it might feel a little bit more depressed than other areas, okay? So if I want to do friction, so I'm doing these different techniques, but I'm gonna add a little friction to that one little spot I found. Okay, you guys definitely want to get closer so you can see what my hands are doing or not doing. So as per your book, when we do friction, you can use your thumb, you can use finger over finger, and they show 3 fingers. Okay? I want you to try them both ways. Okay? For me, I'm most comfortable, control it best when I use my thumb. Okay? So if I found that spasm, so remember now, I'm not sliding over the skin. The skin is going with me. And I'm going to tell her, you got a little spasm there, so I'm definitely going to put some deep pressure into that area. It is going to feel uncomfortable, okay, but shouldn't be painful. I'm going to keep putting pressure until you tell me it's enough. Okay? And again, my pressure is on the up half circle. Relax, come around. See, I'm not sliding. How you doing?
Good.
Is that enough pressure?
You can put more.
A little more? Okay. How about there?
There.
Okay, so when she says that's enough, I hold it there. I don't keep pushing down, and I just hold it there for maybe a minute or two. A minute or two is a long time when you're doing friction. Okay, so then I can do that, and then I can go back to my other techniques. Okay, and then often what you do is after you do them all is then you do your effleurage with deeper pressure, and then do a couple of strokes to lighten up the pressure so that when you take your hands off, it's still nice and relaxing and not a sudden release. Okay. Questions so far? Okay, so now I'm going to say, we're all done. Would you like me to clean the lotion off with alcohol?
No, it's fine.
No, it's fine. But I'm going to clean it off
Okay.
so I can show you how to do it.
Okay.
Okay. But it is up to you guys. But just somewhere along the line, make sure you practice cleaning it off so that you know how to do it correctly. So I'm going to leave the towel there so don't get any on her pants. And again, I'm going to pour it in the towel. I'm not going to pour alcohol on the patient. Okay, so don't need a lot. And then I'm just going to come, and I also should have told her too, I'm going to wipe it off because the alcohol definitely feels cold. Okay. You okay?
Yes.
And then just a little dry, but of course alcohol dries fast. Okay. Bring the pants back up. Take that towel off. I see I left that sheet there on her leg. What I had planned to do is ask her if she's feeling cold and just cover her up for warmth down here. Okay. All right, you okay?
Yes.
All right.